Welcome to Mental Health Mini number 40, Somatic Symptom Disorders. Somatic symptom disorders affect about 5 to 7% of individuals, and it is more common in women as well as in adolescents and children. Risk factors for developing a somatic symptom disorder includes having a lower economic status, living in a rural population, having less education, and exposure to trauma. Somatic symptom disorders are disorders where there's a psychological basis, but they're experiencing the symptoms through physical symptoms. Examples of this that we'll talk about today are illness anxiety disorder, fictitious disorder, and conversion disorder. Sometimes individuals will also develop um, dissociative disorders with the somatic symptom disorders as well. The diagnostic criteria and symptoms for the different types of disorders include somatic symptom disorders in general, and this is when an individual has one or more somatic symptom that causes distress and disruption to their daily life, and they often have excessive anxiety, thoughts, feelings, and behaviors related to that symptom and are out of proportion. So the three different types, as I mentioned, are illness anxiety disorder, formerly called hypochondria, conversion disorder, and fictitious disorder, formerly called Munchausen's or Munchausen's by proxy. So, illness anxiety disorder includes behaviors where the individual is so preoccupied with having an illness or acquiring an illness that they engage in a lot of health related behaviors and have maladaptive avoidance to try and prevent them from getting that illness. They do not have any symptoms of the illness, or if they do, it's very, very mild, but it causes them severe enough anxiety that they're either going to be care seeking or care avoidant. If they're care seeking, that means that they're frequently going to doctors to get screened and evaluated to ensure that they don't have the disorder. Or if they're care avoidant, they would avoid going to any providers because they don't want to confirm that they have that disorder. Conversion disorder is an altered motor or sensory function related to unresolved emotional distress. The physical symptoms that they're experiencing cause significant distress and impairment to their everyday functioning, and there's no biological evidence for the cause. So they do experience the physical symptom, but we can't identify why. Some examples of physical symptoms that are common with conversion disorder are things like being paralyzed, having muscle movement impairment, difficulty swallowing, speech impairment, or actually lack of speech altogether, experiencing seizures, loss of sensation, and urinary retention. Fictitious disorder is a falsification of symptoms through inducing injury or through deception. So they cause the symptoms of the disorder. This may be things like injecting themselves with too much insulin. It may be things like spraying their forehead with warm, moist water before getting their temperature taking, introducing bacteria into cuts or open wounds, different ways that they cause the symptoms. This causing of symptoms has an absence of external reward, such as workers' compensation or other financial benefits of having certain illnesses. And we can have fictitious disorder by proxy, which is when we induce illness or injury on someone else. Another aspect of somatic symptom disorders can possibly be dissociative symptoms. There's a couple of different types of dissociative symptoms, including dissociative amnesia, which is the inability to remember details or circumstances related to a traumatic event. There's dissociative fugue, which is wandering behaviors with the inability to recall identity or how they got to that location. There's dissociative identity disorder, which is having two or more personality states. And when they're engaged with one personality or the other, they have the inability to remember actions between them. This is a very, very controversial dissociative symptom, as psychiatrists and leaders in psychiatric research have very conflicting research and understanding of if this is an actual disorder or not. We also have depersonalization disorder, which is feelings of unreality or disconnection from their body. This could also be called like an outer body experience, or people that describe themselves as watching themselves from above. And then we have derealization disorder, which is feeling disconnected from your environment. Management for somatic symptom disorders focuses much more on non pharmacological treatment, and we often avoid use of medications because there's no biological basis for it. So, using these medications would not result in improvement of symptoms. If we do give medications, it's often based on improving their comfort. And if needed, we could prescribe an antidepressant or an antipsychotic. But typically, we're going to help them shift the focus from their physical symptoms to any traumas or emotional symptoms that need to be resolved. We do want to acknowledge our patients' experience and frustrations, and we do need to still take their physical symptoms seriously and rule out any biological basis. We want to centralize care by having them receive care by the same providers as much as possible. We may give them a diary to track their symptoms and identify any triggers that lead to exacerbation of the symptoms. We can teach them relaxation techniques. It will be important to have a good therapeutic relationship with them, and we can provide them with group therapy, cognitive behavioral therapy, or psychoeducation. As far as nursing problems go, they can be at risk for injury for self or others, have impaired socialization, ineffective coping, or avoidant behaviors. As far as evaluation of effectiveness of treatment goes, they can have coherent sensation and bodily function, resolution of somatic symptoms, improved coping, improved socialization, no dissociative experiences, and development of adaptive coping skills. And that wraps up our mini on somatic symptom disorders.